and concerns regarding our positivity rate. This will include details coming out of our Barnett Park location, where there is still testing and vaccinations. Mayor Demings will discuss multiple locations where a citizen can be tested, and there are many, and vaccinated. The mayor will also have information on the Emergency Rental Assistance Program and will offer other information as well. As you can see, Dr. Raul Pino from the Florida Department of Health is also here to discuss very urgent details regarding infection rates and state vaccinations. We begin with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. Thank you to all of you. Hopefully you had a great weekend. This is our 142nd press briefing regarding the novel coronavirus called COVID-19 that we've done over time. So I have a lot of information to cover with you today. As the director of the Centers for Disease Control recently put it, COVID-19 is becoming a pandemic of the unvaccinated. Florida now holds the dubious distinction of having 1 out of every 5 coronavirus cases in the nation. Last week in Florida, there were 23,000 new cases. The numbers really don't lie. Today in Orange County, we have a reported 570 new cases from just yesterday alone. We have seen the numbers as high as 700 plus over this past weekend. All of these cases were unvaccinated individuals. 1 week ago, I strongly recommended that both vaccinated and unvaccinated residents should wear a facial covering while in crowded indoor spaces. I remain committed to that recommendation. We find ourselves in a bit of a conundrum at the local level because of the new law created by the governor and the Florida legislature, which restricts local government's ability to enact mandates during a public health crisis. I've had many conversations now with the county attorney's office about the options that we have at the local level. And essentially what they have said to me, any such mandates would have to be narrow in theory, but must not be fatal in fact. So essentially what that does is tie the hands of local governments to be able to make decisions really in the best interest of our residents. Given the continuing rise in coronavirus infections, I'm asking our residents to continue to protect themselves and others by voluntarily wearing facial coverings while indoors in crowded spaces. My appeal really is to the businesses as well. We ask our businesses to voluntarily comply with this recommendation, that you seriously consider requiring those who are patronizing your businesses in crowded spaces when indoors to require your patrons to wear facial coverings. As I've said many times, if you are not vaccinated, now is the time to do so. For those individuals who are being infected by others, I wish that there is more that I could do to protect you. However, you hold the key to your own destiny during this public health crisis. You can open the door to the opportunity to protect yourselves by simply getting vaccinated. This is a statewide issue, and Floridians should hold the governor and legislature accountable for the continued spread of the virus in our communities. They hold the cards at this time. As for the latest COVID-19 case numbers, here within Orange County, our 14-day rolling positivity rate is now in the double digits. That's not good. Today, our positivity rate is 11.2%. That is nearly triple what we were experiencing 3 weeks ago. On June the 28th, we reported that the 14-day rolling positivity rate was 4.28%. Orange County remains in the CDC's high-risk category for community transmission. On the positive side, 61.2% of Orange County residents ages 12 and above have had at least one shot of the vaccine. Since the start of the pandemic, there have been 154,674 positive cases in Orange County, and 1,375 people have died of the virus. So we cannot emphasize enough the need for residents to get vaccinated from this deadly disease. To that end, our health services will continue to offer free testing and vaccine through the end of at least August at Barnett Park. With the number of infections increasing, we need our residents to get vaccinated. Barnett Park will remain open 7 days a week between the hours of 9 a.m. and 5 p.m., and individuals have a choice of either the Pfizer or the Johnson & Johnson vaccines. We are also seeing a high demand for COVID testing. Barnett Park alone is averaging 1,400 tests a day for the coronavirus. Due to the numbers, the line for testing and shots may close prior to 5 p.m., but everyone who is in line at the time that they shut it down will be able to get tested. We also ask that if you're going to the park, try to arrive early. We suggest that you try to get in line before noon. And let me talk a little bit about some of our outreach that has been going on. The I Got My Shot mobile trailer can vaccinate up to 300 people each day. We ask that you consider taking advantage of this opportunity. We will be at the Villas at Hampton Park this morning. The trailer will be at 8 other Orange County locations this week, and I believe there's a graphic behind me that shows the locations. This afternoon, starting at 3 p.m., the trailer will be at the West Oaks Mall near the Orange County Tax Collector's office. Tomorrow morning, the vaccine trailer will be at Goodwill store on Goldenrod. On Wednesday, the mobile trailer will be at 2 additional locations. The first will be Lake Eola near the corner of Roslyn Avenue and Washington Streets in downtown. That is happening also this morning. Then at the Wadeview Neighborhood Center on South Street and Summerlin in the afternoon. On Thursday morning, the vaccine trailer will be at the Winter Garden Goodwill store on West Colonial Drive, and then on Thursday afternoon, the Bravo Supermarket on North Hiawassee Road. And finally, on Friday, the trailer will be on the M.A. Board Street in Apopka at the Billy Dean Community Center. And Orange County is proud to support additional vaccination efforts countywide to ensure our residents have no excuse for not getting a shot. On the morning of Saturday, July the 24th, there will be a free COVID-19 vaccination opportunity at the Jacqueline Bradley and Clarence Otis Boys and Girls Club on Lakeland Avenue near the Camping World Stadium. This is the 4th Communiversity Vaccination Strong event that has been held. It features the Johnson & Johnson Pfizer vaccine, free food, gift cards, and other giveaways while supplies last, trying to create some incentives for individuals who need an incentive to get vaccinated. The event will run between the hours of 9 a.m. until 3 p.m. on Saturday. Among the sponsors are the Orlando chapter of the Links Incorporated, Second Harvest Food Bank, the Boys and Girls Club, and the Florida A&M College of Law. Orange County's Emergency Rental Assistance Program remains open and ready to help rent-stressed residents. Qualified applicants can receive 12 months of past due rent and 1 month of future rent payments totaling up to $20,000. To date, $4 million has been paid out to keep families in their home. That is still, there's still more money available. Residents can visit our website at ocfl.net/rental assistance to get additional details. There will also be a virtual training session held on the afternoon of July 28th for any interested organization that wishes to assist clients with the application process. Organizations can go to ocfl.net and register for the virtual training session. And for students planning to attend Valencia College in the fall, there is good news. The COVID-19 financial relief is available through the American Rescue Plan for such students. And a student enrolled in at least one class will be eligible to apply for $1,500 or $2,000 in emergency grant aid, which the college will distribute to students in October. Students will have to confirm that they have a financial need related to the cost of attendance or emergency costs related to COVID-19, such as tuition, housing, health care, or child care. There are smaller grants also available between $500 and $1,000 for students enrolled in accelerated skills training programs or English language programs. For more information, you can call, there's a number available, 407-582-1507, 407-582-1507, or you can visit the Valencia website at valenciacollege.edu/future-students/visit Valencia. I know that's a bit long, but hopefully the graphic has it. And with that, I'm going to turn it over to Dr. Pino. He will be able to delve into the data a bit more and share with you precisely where we are as a community. Dr.
Good morning, everyone. Thank you, Mayor. First, let me say Albina is also here with us today, so in case that anyone has any specific question for her during this or later, after the presser. The Mayor mentioned to you some of the data points. We are concerned, very concerned where things are. Just to give you an idea, our numbers in cases are reflective of January of this year. So in the number of cases, we are back to January. Yesterday, we have 570 cases. The day before, which was Saturday, we had 651 cases. And the day before Friday, we had 730 new cases. As far as we can see, all those 3 days that I have mentioned to you, all the cases were among unvaccinated individuals. So that gives you an idea of what the CDC is saying and what the Mayor just mentioned, that this is a pandemic among unvaccinated individuals. Thankfully, the hospitalization data and the ICU data and also the death data continues to reflect a decrease or a stabilization of the numbers, and that is due to the high number of vaccinated individuals in people who are 65 years and older, who tends to have the worst case scenario consequences for this pandemic. But that doesn't change the fact that it has been an increase to ER visits, which were lower later in a couple of weeks, could translate in an increase of hospitalizations and well as at ICU bed usage, which is concerning. The number of deaths is up to 1,375. Today, we are reporting to you 5 additional deaths, 1 female, 4 male, and 1 death is from June, 4 are from July. The age range is 41 to 91, and all deaths were among unvaccinated individuals. So all these were preventable, as well as a high percentage of all the infections that we have during the weekend. Our advice to everyone is consistent with what the mayor just said. If you are going to go into indoor settings where there is a crowded environment or an environment where you are unsure of who is vaccinated and who isn't, if you want to protect yourself and your family, if you are unvaccinated, we highly recommend that you use your mask. If you are vaccinated, we ask you that you consider wearing a mask going into these environments. We have had some breakthrough cases in people who are vaccinated, although they don't seem to experience the same level of disease, sickness that unvaccinated people experience. It's also important to protect yourself and add this other layer. It's actually the high volume of transmission that is happening among unvaccinated people makes it a little bit risky for vaccinated people, and especially for vaccinated people with pre-existing conditions. Those individuals should take that extra layer of protection. Remember, the vaccines are very good, very effective, but they are 95, 96, 93, so there's always a chance that someone who is vaccinated could get a little bit of it. With regard to age, it continues to be 15 to 44 years old. That's where we have the highest number of cases. And in yesterday, 53% of the people infected were in that age group, 15 to 44. And that's probably where we have also the lowest vaccination rates. Just to give you an idea, the last week that we start decreasing was week 25. So remember, I mentioned to you before that in epidemiology, we go by the weeks of the year. So just to quickly run these, in weeks 26, we have an increase of 21%. In weeks 27, we have an increase of 63%. That's the week that we gave you the first high alert. On week 28, we have an increase of 51, and in week 29, the week that just ended, we have an increase of 58% of the number of cases. Our positivity rate, as the mayor mentioned for yesterday, for the day, was 16.3. We haven't had that in a long, long time. Our 14-day rolling average is 11.2, as the mayor mentioned. Just to give you an idea, July 5th, we were at 5.7. Today, we are at 11.2. The number of Delta variant cases have increased to 95, although it should be higher than that. And then at the national level, they have reported that 50% of all, more than 50% of all new cases are cases of the Delta variant. And everyone thinks that the presence of the variant with a number of unvaccinated people, may have contributed to this increase that we have seen. We have following several outbreaks, some of a small nature, some a little bit different, but just to give you an idea, and we are calling it outbreaks, even a single case in a long-term care facility will be considered an outbreak. We have mentioned that to you before, and the idea is to quickly mobilize resources to be able to protect the elderly. A normal concept of outbreak is 2 individuals or more, but in the case of long-term care facility, we are acting as if one was also an outbreak. With the number of vaccinated individuals, we have a total of vaccinated individuals with at least 1 dose at 61.2%. Those are for eligible residents, that is 12 and older. And the same for the age group, fully vaccinated, we are at 53.3%. With that, I will answer any questions that you may have. Thank you.
Okay, we're opening up for questions. I do recognize that Commissioner Mario Uribe has joined us. Also, we have Attorney Jeff Newton from the County Attorney's Office. We have Mr. Danny Banks, the Public Safety Director from the school district. Mr. Scott Howard is here, should you have any questions for any of them at this time. So we'll open it up. Okay, so we have a mic that's moving around.
Una pregunta en español, doctor Pino. Bueno, si nos regala por favor un pequeño resumen de lo expresado en español. Pero una primera pregunta, y aprovecho para hacerla, ¿no? ¿De qué dependerá que se comience a exigir el uso de máscaras y que no sea de manera voluntaria como se está haciendo ahora? Uno. Y dos, ¿qué le dice a los dueños de negocios? Algunos no están tomando las medidas y la aglomeración de gente en los negocios es mayor a partir de que se liberó un poco más el Estado, ¿no? Y la ciudad como tal.
First, the question was if I can give you a brief update in Spanish of what I just said in English, and the question also what it will take to make a mask mandate, and also what is the advice for business owners with regard to the mask. El update. Los números se han continuado incrementando. Los números de casos hoy es muy similar a donde estábamos en las primeras semanas de enero y nos preocupa tremendamente que se hayan incrementado. Para darles un ejemplo, el viernes tuvimos 730 casos, el sábado tuvimos 651 casos y el domingo tuvimos 570. Lo interesante es que todos esos casos son en personas que no están vacunadas. El número de muertes se ha elevado por 5 y también todos los que fallecieron en esta semana, o que estamos reportando en esta semana, no estaban vacunados. El mayor número de los casos está entre las edades de 15 a 44 años y ha habido un incremento de casos semana tras semana en un % elevado. El positivity rate, algunas veces es muy difícil traducir en el aire. El positivity rate es 16.3 para el día de ayer y 11 para los 14 días que estamos siguiendo. El número de variantes se ha incrementado a 95 y ha habido un incremento de las visitas en los salones de emergencia. El % de inmunización está en 61.2 para una sola dosis de las personas mayores de 12 años y 53.3% de dosis completas para las personas también de mayores de 12 años. Con respecto a las preguntas que me hiciste, yo no sé qué es lo que toma para dar un face covering, mask mandate. No es una decisión política, no es una decisión que yo pueda tomar. Todo el papel mío es proveer la base de datos, proveer el consejo que cuando se me pide, y eso ha sido dado. So for what will take to make a mask mandate, I don't know, because that's a political decision. I don't have the power to decide on a mandate. Our role is to advise when we are asked for advice, and also to provide information when is asked. We are in constant communication with the leadership in the county, and we are very transparent and offer all the information that we have received. La segunda pregunta, con los negocios. Mi consejo, si yo fuera un dueño de negocios, yo tendría una señal en la puerta de mi negocio que recomienda altamente a las personas a que se pongan máscaras. A los negocios individualmente también pueden exigir que las personas se pongan máscaras y me parece algo muy razonable en las condiciones que estamos, con alto número de transmisión y también con una variante que está muy infecciosa. The answer to the second question, what will be the advice for business owners, is you have the ability to mandate if you want for masks to be used in your premises. My advice is that you either highly recommend that people use masks in your businesses or that you make it a mandate, taking in consideration that it's a highly transmissible variant out there and we have a high number of cases. That's it.
Hi, this is Stephanie with Fox 35. This is for Mayor Demings. Can you elaborate more about the conversation you had with the county attorney's office about those options at the local level, and are you pursuing any legal action with the state?
There's some legal challenges with enacting a state of emergency during a public health crisis or any other executive orders or mandates. Any such mandates will have to be narrowly tailored and based on data that cannot infringe on individual or business rights. However, the state controls the data, okay, and therein lies part of the problem. We simply can't reach that high legal bar if we don't have access to data real time. So in terms of the legal issues, I'll ask the county attorney to come forward if he thinks I said anything inaccurately or if I missed something. Jeff Newton.
No, forgot I had this on for a minute. What the mayor indicated is 100% accurate. What you need to understand from a legal standpoint is that in this past legislative session, the legislature approved amendments to the Emergency Management Act, and those amendments were approved by the governor as well. And part of that act requires that any mandate dealing with a pandemic, or I should say a non-weather related emergency, must be narrowly tailored and not infringe upon the rights or liberties of individuals or businesses. And that is a very, very high legal standard. It's almost, at least in my opinion, an insurmountable standard that has to be met. And so you've heard the mayor refer to it as any mandate needing to be narrowly tailored, as well as strict in theory and perhaps fatal in fact. That legislation also provides the governor with the ability to invalidate any local government order that doesn't meet that narrowly tailored and standard. And so it's very problematic for local governments to institute any mandate that would assist in dealing with the situation we find ourselves in with respect to the COVID-19 disease.
Okay.
A question for both the mayor and Dr. Pino. It appears that now where we're at the pandemic is possibly that you're just hitting a wall. Every week you're saying, get vaccinated, get vaccinated, get vaccinated, and then you provide the information and the data, and yet it seems like those who are choosing to get vaccinated are, and those who aren't are not. So what is your final plea, or how are you feeling to try to convince those to get a vaccine who haven't?
Well, I think part of what we're seeing here as the rate of infection is increasing amongst the unvaccinated is that sooner or later, if you're unvaccinated, this virus is going to march right into your household. And the consequences can be severe. When we look at the hospitalizations at this point, Dr. Pino and our other hospital advisors have said that essentially those who are being hospitalized are those who have tested positive, who have contracted the disease, who are unvaccinated. So if there's anything that we can say to you to try to motivate you to get vaccinated, it is that. Protect yourself, protect your families. Unfortunately, I think early on with this pandemic, these issues were politicized along partisan lines, and that just simply was not right. And we've been struggling trying to overcome that ever since. And some individuals have been privy to misinformation, but generally speaking, the science is fairly simple. And I think as we have lived through this experience as human beings, the case has been proven at this point, because those who are have been vaccinated are not the ones who are contracting the virus at this point. It is those who are unvaccinated. So I think the proof is obviously staring all of us in the face at this point. We've tried to be creative to ensure that we have made the availability of access to the vaccine convenient. We have taken it right into people's homes. We have taken it into their neighborhoods. There are retail outlets that have provided the vaccine. We're partnering with community-based organizations. So we're doing everything that we can do here at the local level. But we've been fighting upstream now for some time. And so this last 20% or better of the population that needs to become vaccinated is proving to be very difficult. It's a challenge. We need you, the media, to be our partners in this process and accurately report the information that is available. And I know that Dr. Pino, as a healthcare expert, he supports this initiative and everything that I've said, but I don't speak for Dr. Pino. Dr. Pino, you can certainly share here what you feel like you need to share.
I do agree. I think that we are starting to make some progress. It's interesting. I was contacted this weekend on Facebook by someone who was against the vaccines, and after hearing our plea last week, the person decided to get vaccinated. And it is interesting, she directed me to a Facebook group of long haulers, people that have still experiencing symptoms and signs of the disease even months after they experience the disease, and those are local. And for those who are not convinced of what this can do, they should check that group on Facebook, the long haulers in Orlando, in Orange County. The experiences, the pain, the suffering that these individuals are going through, even months after having this disease, is quite debilitating for many of them. And here we have a treatment, a clinical intervention, a vaccine, or in deficiency of that, because you may not be able to get vaccinated, a mask that can protect you. And here on the other side, we have that everyone that we have seen this weekend, every single death that we are reporting, every single person has been unvaccinated. So I think the choice is very clear. Not only that, we did an analysis that we are completing. Since we have the fully immunized person in February 6th, I believe is the day. Is that correct? February 6th was the day that we have the first fully immunized person in our county. At least 95% of all infections and all death since February 6th has been among unvaccinated people. So that's how this pandemic is fueling and going through unvaccinated people. And again, our concern continues to be the same. More transmission, more chances to get variants. Variants could get more aggressive. We could see more damages coming down if we don't take the steps that we need to take. And it rests in every single individual right now that is unvaccinated to make that decision.
Mayor Demings, Nadine with News 6, all the way in the back.
Oh.
Perfect. My question is, you had used phrases like, I wish I could do more, my hands are tied. I mean, we hear the frustration there. If you could do more, I mean, would we be seeing a mandate if you had the chance at this point with our numbers? And honestly, is there any hope that we could stop this in another way other than just asking people to get vaccinated? Are we having conversations with the governor's office? Can we get the data again? I mean, is there anything else? And then Dr. Pino, how bad could this get, considering that the numbers are stalling with vaccinations but climbing with cases?
You know, I hear from members of the public in various ways. I think the overwhelming majority feel like something needs to be done in the way of some type of mandate without adversely impacting our economy. We all want to keep our businesses open. I certainly want to do that. We want to do that in a very responsible way. So what I say to Floridians is, go to those who control the cars at this point. That's the governor and the legislature. Talk to them about it. And, one thing they respond to is political pressure. So I put the pressure right where it should be at the local level. We have to live in our communities, and when you diminish the ability of local governments to make decisions on behalf of the people who live within those local communities, you end up putting us at a disadvantage, and thereby also putting the people at risk as well. But we find ourselves at this crossroads in our history, and it is what it is. Okay.
So on how bad it could get, right now we are at the same levels that we were in January for new cases. So that is bad. With regard to that area, we are experiencing as many new cases as we had when we were at the highest levels. What is different is because we have a high percentage of vaccinated people, especially people 65 years and older. Then we have not seen a significant increase in hospitalizations, ICU bed use, or death. But again, that is today what we have. That scenario could change. Coronaviruses, and this one is one, could be selectively aggressive in some areas more than others depending on mutations. And for example, the flu could be one year attacking more younger people than other years, some years causing more death in some age groups than others. And our concern is a new variant that is more aggressive, that transmits even faster than this one, that will affect vaccinated people and that will affect people in long-term care facilities. And that's when we will experience then a high-level hospitalization and death rate, and that will be a crisis that we don't want it to be in it.
I'm back here. I have a question for Dr. Pino. Jeff Allen, Spectrum News 13. Just with your latest health data and the new cases, is there any indication on if there's a particular part of Orange County that where a chunk of these new cases are coming from, or is it just spread out all over?
I haven't seen the geospatial data yet, but it's my assumption, Albina, that it's all over the place. It's not a specific area.
This is Melissa Thomas with Florida National News. This question is for Dr. Pino as well. Forgive me if somebody asked this already, but just want to double check. Obviously, we have a lot of attention going on the Delta variant. And one of the things that, of course, Ms. Hsu let us know very clearly early on is that with any kind of virus, there's always going to be an evolution of variants. So are there newer ones that are coming up that are now areas of concern?
Albina will come and take that question. I just cited her.
So as you accurately mentioned, yes, there are, with every new infection, there's this ability for the virus to gain mutations or possible adaptations. And so part of the national, state, and local tracking that we have here for genomic surveillance does identify variations or changes. And so if you can track on the CDC website, they've publicly published variants of interest and also variants of concern. So the ones of interest are the ones that we are watching to see what's coming up, and the ones of concern are the ones that have public health consequences. Currently, the WHO naming convention has it go in sequential order. I believe we're currently on Lambda, and there are several other variants of interest that you might want to take a look at. Also, we track by lineage, and so we are looking to see what kind of variations we can identify, even the ones without the names, and to see whether or not those cause severe hospitalization or death or have increased transmissibility.
My next question is for Dr. Pino. I appreciate in Spanish, please, for Univision. Andreina de Univision. Mi pregunta es, usted está hablando de que los casos generalmente provienen, el contagio de los casos vienen de personas jóvenes, personas entre 15 y 41 años, si no me equivoco.
44.
44 años, perdón. ¿Hay algún plan específico o ya en conversaciones un plan contundente de vacunación para las escuelas? O sea, ¿hay algún plan fuerte para vacunación? Porque sí, ya vienen las clases. ¿Y cuál es la preocupación que hay con respecto al comienzo de clases, tomando en cuenta que estas son las edades de mayor contagio? Gracias.
Tu pregunta es muy buena. So the question was, do we have any aggressive plan for vaccination in schools as many of the people affected are in the younger segment of the population? And I don't know if Scott wanted to talk about anything on here, but in Spanish. Tenemos un plan, no hay un plan agresivo de inmunización porque no hemos tenido aprobación de las personas menores de 12 años. Para las personas mayores de 12 años hemos continuado ofreciendo vacunaciones en algunos casos en las escuelas para que se puedan vacunar. Pero recuerden que es importante tener la forma firmada por el padre que autoriza a ponerle la vacuna al niño. Si no tenemos esa forma, no podemos vacunar. Tenemos un plan muy agresivo desarrollado para iniciar testing en las escuelas, la prueba para el COVID-19. Cuando comience el curso escolar, si recibimos aprobación financiera y de nuestro plan. La idea es que en muchos casos vamos a hacer pruebas en la escuela misma, solo los niños pueden continuar asistiendo a la escuela, pero todo dependerá de qué orientaciones recibimos del gobierno. The answers in English to the question was, we don't have an aggressive plan for vaccines in school yet because younger than 12 are not authorized to be vaccinated. We have developed an aggressive testing plan for schools that need to be approved and receive the funding for that will address the issue of identifying as early as possible infections in the school so that we can keep the school as safe as possible. As soon as those authorization for vaccines are in place, we probably will go through the schools and staff vaccinated. We have done it for middle school, so we can easily replicate the model and do it for other schools.
So I see Scott Howard from the school district on deck. If he wants to add something, and perhaps Ilia Torres can translate for him in Spanish.
Thank you, Mayor. Thank you, Dr. Pino. We do currently have ongoing vaccination events leading up to the first day of school. We'll continue to build on those events as we get closer.
Actualmente la Junta Escolar tiene planes de vacunación sostenidos y tienen planes de continuar con la vacunación, las jornadas de vacunación hasta el comienzo de clases.
You can check the website. It's COVID-19 vaccination information. It's on our front page, and click on that, and all the events are listed. We'll continue to build, as I said, on that list as we get closer to the first day of school.
Pueden consultar la información en nuestra página web. Se encuentra disponible en la página principal, donde tenemos un listado de todos los eventos, y nuestra intención es continuar añadiendo los eventos a medida que se van planificando.
Just a reminder, ages 12 to 17 or 18, but 12 to 17s need to have their parent or guardian present in order to receive the vaccination, and they are occurring in the late afternoon, early evenings.
Como recordatorio, estamos vacunando de 12 a 17 años con consentimiento de los padres y 18 obviamente sin consentimiento, y eso sería todo.
Thank you.
Gracias.
This is Steve Hudak from the Orlando Sentinel. This is a question for the mayor and for Dr. Pino. In the past, we've had people say they didn't want to wear face masks or adhere to the other protocols because they said they were infringing on personal liberties and ineffective. I notice all of you are wearing masks. I have one, and I feel like I should be wearing it right now. But what do you say to those people? And some of those people are the same people who are saying, I'm not getting vaccinated. So I guess it goes back to my original question to him last week, which is, are we screwed? And so that's...
You know, Steve, I hear the frustration in your voice. I hear it in the residents of Orange County from time to time. But the only thing I can say to individuals who have the opportunity to get vaccinated and don't do so, it's like playing Russian roulette with your own life and perhaps the lives of others in your immediate family as well. I would advise them not to do that. In terms of whether or not the facial coverings work or not, I've read numerous scientific research documents that say otherwise, that facial coverings do work and the vaccine does work. So I think that there are those who will debate that, but the fact of the matter is when we look at our real experience, the individuals who are testing positive today, the individuals who are primarily going into the hospitals with COVID-19 are unvaccinated persons. Again, I think the evidence is staring us right in our eyes. Okay, Dr. Pino.
Yes, sir. I think the mayor said it well. The reality is that the masks are effective as a blocking source of the infection. You know, it keeps the virus blocked from spreading or acquiring, but it's a temporary fix because it's only as good as you wearing the mask. The permanent fix or semi-permanent, we don't know how long it will last. We think that it would last some time, is getting vaccinated. Now, if for whatever reason you can or decide not to wear a mask, and for whatever reason you decide or not to get vaccinated, there's going to be a reason. You more likely would get infected, especially in this type of level of transmission that we are experiencing. It is a fact, and it's up to the individual to make that decision if they want to protect themselves, protect others, but especially their family. And that's where we want to keep hammering this message on. You will bring this infection into your home. If you are a teenager, if you are a healthy young individual who think this will not do anything to you, and you probably could be right as your age that you will experience this infection, counting that you may not have a long-lasting effects, counting that you may not be in the hospital, you may not go to ER, you may not die. But if that happens to your uncle, your aunt, your grandfather, your grandmother, those individuals, the chances are a lot higher to die from this disease, especially if they are unvaccinated too.
I'm Nick Papantonis, WFTV Channel 9. I'm going to follow up on that. For the last year and a half, we were told vaccines were the answer to the pandemic, would keep us from having this continue forever. Vaccines are still clearly the answer. How do you